It has now been more than a year since the U.S. saw its first wave of COVID cases, and one troubling aspect of the virus that's becoming increasingly clear is that it affects everyone differently. And it's not just the degree of the severity that can vary greatly, but the types of symptoms themselves that doctors are still feverishly researching. You may have heard about the loss of taste and smell, but what about issues with your eyes? May Kravitz and her friends were among the many who contracted COVID-19 over the past year and didn't even realize it.
We went to a friend's dinner and none of us knew that someone had COVID.
She briefly felt sick, but then thought it had run its course.
I felt shortness of breath, but I didn't lose my taste. I didn't lose my smell. I didn't know. So I was sick for like 3-4 days and it went away.
But soon, she started to experience an unusual symptom.
I actually cried about something. I was having a conversation with a dear friend of mine, and I thought that I'm having eye pain and headache from crying, because usually that's what happens.
May and her friends all started suffering from an eye pain that was so excruciating, she called Dr. Jeffrey Della Russo for answers.
And I said, listen, I have something really weird going on. My eyeballs feel like they're about to explode, and I can't move my eyes up and down or to the side.
At first, Dr. Della Russo thought she might have multiple sclerosis.
So somebody in her age group, female, when they have issues with pain in the eye or particularly pain on eye movements, it sets off certain alarm bells.
But then a realization that the eye pain could be connected to COVID-19.
The whites of people's eyes, it's a mucous membrane, just like you would have your mouth, nose, and nasopharynx in the traditional routes of transmission of the virus. It's perfectly reasonable that that's been, an underlooked route of transmission.
The CDC lists a number of common symptoms to watch out for if you think you have the virus. Many focus on respiratory issues or fever. But long hauler side effects and other possible symptoms like COVID toes, where patients report rashes or discoloration, or even COVID tongue, swelling or lesions in the mouth, have shown there's still a lot to learn about this virus.
We know that a range of symptoms can occur with COVID. It's not necessarily just shortness of breath and fever, especially with milder conditions. It may just be eye-related pain or itchy eyes. That could have been a telltale sign of COVID, but we just didn't know to diagnose or test for that patient, especially early on.
Studies appear to show a large percentage of COVID-19 patients have had eye symptoms. Many had conditions that were generally mild, though some patients reportedly had eye nodules that researchers say could be from the virus.
The vast majority of patients recover within 2 weeks, and so it's very short-lived. But just like the broad range of symptoms for COVID, where we've seen a small portion of patients experiencing this long COVID condition, that can also happen when it comes to the ocular symptoms, which can be a longer duration and take more time to recover or be more severe in nature.
For May, the eye pain was just the beginning.
Anything I did required so much effort that I had to sleep for hours after. It was very uncomfortable. I was nauseous and headaches and muscle pain.
Thankfully, May's eyes have improved with time, but the condition is causing some to question if more eye screenings or protective measures would help.
Thinking about eye-related protection, especially if you're in a high-risk category, makes sense, or if you're in a high-risk environment where the likelihood of transmission is increased.
The CDC does currently recommend that healthcare providers wear eye protection when meeting with patients, particularly in areas with moderate to substantial community transmission. Dr. Anthony Fauci weighed in with our Dr. Jennifer Ashton.
If you have goggles or an eye shield, you should use it. I mean, it's not universally recommended, but if you really want to be complete, you should probably use it if you can.
If you're having a rapid onset of eye pain, I think it's a good reason. It's a pretty reliable signal to go get tested for COVID-19. If it can be an early symptom, go get a test and begin the isolation and all the best practices that we all have had drilled into our heads over the last year.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.